When do I actually fire my doctor? When do I walk away? When do I tell my doctor to go pound salt? Well, that's what we're going to talk about today, because so many of you, and I see this in my Facebook group, I see it in other Facebook groups, I see it posted everywhere, that people are still hanging on and having hope, which I always say to have hope, but placing their hope in the wrong places, placing their hope in that maybe this time, this doctor who refused to test my reverse T3 will actually pull through and treat me right and get me to an optimal level in my thyroid and my hormones. There are times where you just have to face reality, see it for what it is, not for what you want it to be, and move on so you don't waste precious time. So here's the scenario that I see so often. You go into your doctor's office armed with all of the questions that I tell you, all of the labs that I want you to get done, and that way you can get that full picture of your health. And so can your doctor, by the way. So with full labs, you and your doc can sit down. This is what I do with my patients, can sit down and really comb through and ask you, how do you feel? Look at your labs. Are they optimal? Are they not optimal? Do we have to do anything? Can we actually spend time and paint this picture? Because thyroid is connected to insulin resistance, and insulin brings up inflammation. And then that inflammation makes you gain weight and can cause a host of other conditions. Oh, and then that low thyroid function, because your reverse T3 is elevated and your free T3 is low, that's causing weight gain, depression, brain fog, and hair loss. And oh, look at this over here, your ferritin's low too. So that's going to interfere with your thyroid function and T4 to T3 conversion. And that's also going to contribute to your hair loss. Oh, look at your zinc. Well, your immune system's really low and you have Hashimoto's, so that's not good. Oh, and zinc contributes to hair loss as well. Look at your testosterone. That's in the toilet. So you have testosterone low, insulin high, thyroid low. You have no metabolism. That's why you're not losing weight. That's why you're gaining weight. That's why you have no motivation and no libido. Oh, look, progesterone's low too. That totally makes sense why you're anxious and you can't sleep. And that also ties back to thyroid function. You see, I just did that in 2 minutes. Has your doctor ever done that for you? Has your doctor painted that whole picture? Well, if they did, stick with them. If they haven't, leave. So signs of when to actually fire your doctor. A, you walk in with your laundry list of symptoms and the lab list that I give you, asking for all of these labs to be tested, and you get a no. Right then and there, time to get a new doc. If your doctor does not want to do thorough testing to find out what is going on with you and to paint that picture that I just did in 2 minutes with a bunch of different tests, all of which are on the sheet that you can download, take to your doctor. If your doctor doesn't even want to do that, what the hell kind of treatment do you think you're going to get moving forward? Honestly, ask yourself that honestly. If your doctor will not even order a test to find out what is going on inside of your body to pair up with the symptoms that you are telling him or her that you have, then how are they going to proceed from there? How are they going to have an answer to what's going on with you? Oh, wait, I know. They'll give you a Band-Aid. Here's an antidepressant. Here's a sleeping pill. Here's a statin and a blood pressure medication and some Synthroid. Good luck. Let us know how you do. No, time to fire and leave. Walk, or run far, far away from that particular doctor. Scenario 2, you get all the labs. Doc says yes to labs, you get all the labs. Now, you know, through listening to me, that we don't want that reverse T3 in a thyroid panel above a 12. I really want your free T3 if you're going 24 hours without medication. I really want that free T3 like 3.5 or above, or in the upper quadrant of that lab value range. I want your testosterone, ladies. Total testosterone should be 50. Progesterone to estrogen ratio should not be more than a 1-to-20 ratio. Meaning if your progesterone is a 0.5, which I see all the time, and your estrogen is 200, that's an estrogen dominant low progesterone state. So once you have the numbers in front of you and you know what those numbers mean, and your doctor tells you that you're normal, time to fire, walk, run. Time to go. Time to go. Because what do I always say? You know your body, A, and now you're learning your body's numbers and where they should be, B, so you are knowledgeable enough to know when you're not normal, air quotes. We want you optimal, not normal. So if your doctor will not help you get optimal, it's time to go. Now, this applies, by the way, side note, and this bears repeating, even though I have other podcasts on this. This applies to everyone. MDs, DOs, naturopathic doctors, they're NDs. This applies to nurse practitioners, PAs, functional medicine practitioners, alternative practitioners, or whatever label they want to use. I don't care if they are in the functional, integrative, naturopathic space. You can still fire them. Just yesterday, a new patient signed on to work with me. And, we're always chatting and we're, before we schedule you, we're jumping on a call and I'm talking to you and we're talking and she says, yeah, so I was going to this naturopathic doctor who actually could prescribe. Some NDs can, some can't based on the states and their laws. So she's going to a naturopathic doctor and this ND who can prescribe, okay, listen, started her on NP thyroid. Okay, kudos. It has a little bit of T3 in it. Then that wasn't working. She was feeling worse. So he switches her to Synthroid and 5 micrograms of liothyronine T3. Then he brings her up to 10 micrograms of T3, does not tell her to split the dose. When she says that she's getting jittery, he pulls the T3 out completely instead of trying to figure out why she's jittery. Maybe you should, split the dose up a little bit, dude, instead of giving it to her all at once. Because you just took her like from 5 to 10 and you told her to take it all at once. T3 is great. There's a reason why you started her on it. Why the hell would you pull it? So he pulls it and now she's on Synthroid only and crashing into hypo. And he tells her that her thyroid numbers are normal. Naturopath, folks, naturopathic doctor. Another story, functional doc, functional, conventionally trained turned functional, like many of them are, like many of us are, right? That's okay. It's okay. As long as you fully come over into the functional space. Functional doc says, I just don't like TSH below 1. I go, why? Why? I don't know this person. But in my head, I'm going, why don't they like it below 1? So I'm talking to a new patient. Yes, I was working with a functional doc before and she was helping me with my thyroid, but she doesn't like my TSH below 1. I go, you realize that TSH is going to go down if you're on any kind of T3. It can even go down if you're on T4 only for years. That TSH is a pituitary hormone. Does your functional doc know that? It's not a thyroid hormone. Just going back to biology here, because sometimes, these docs need a refresh on how our body works. So TSH, pituitary hormone, not a thyroid hormone. Did she happen to look and see that your free T3 is a 2.8? And that your reverse T3 is a 16 and you feel like garbage? Did she ask you how you were feeling? Did she ask that question? Just wondering? No? Oh, okay. So she's focused on your TSH being freaking above a 1, right? Do I have that right? Yes. Fire that doctor. Run, not walk away. Because if you stay with the doctor, and I don't care what their term is, what's on their website, I don't care. If your doctor, functional, integrative, naturopathic, conventional, NP, PA, DAO, MD, focuses on TSH because they really want it above a 1, God forbid you're suppressed, basic physiology, then, and they're not asking you how you feel, and they're not paying attention to the free T3 and the free T4, and they're not looking at the reverse T3, and they're not checking your hormones, and they're not checking your insulin, and they're not checking your nutrients, you run, not walk. Yes, you give up the money that you paid them. I am sorry that you wasted it. That's why I'm here trying to educate you so you don't waste money. You run, not walk. Run, not walk. Another scenario, I'm giving you one more, bear with me. Another scenario would be if your doctor, and remember, this is across the board, functional, naturopathic, ND, MD, DO, PA, NP. If your practitioner says that they do not do bioidentical hormone replacement therapy, that's a key part of treatment. If you are above the age of 30, really, there's a really good chance, and some 20-year-olds and even teens get affected by this, but it's usually a genetic thing. If you are above the age of 30, your hormones can be wonky. You might be trying to get pregnant and had multiple miscarriages. That's thyroid and hormones. I have seen 35-year-olds with progesterone levels that of a 70-year-old. I have seen 35-year-olds, 40-year-olds, 50-year-olds, 55-year-olds, 60-year-olds with testosterone so low, my jaw is on the floor that no one tested or treated this. Ladies, you cannot walk around with a testosterone of a 10 or much less a 20. You need that higher. You need it higher. So if your person, your practitioner, is not doing bioidentical hormone replacement therapy, will not use more than Synthroid or T4 or Levo or Tirosint, will not use anything else other than NDT. That's another red flag for me, because when I am asked, what is your favorite thyroid medication? I am going to answer with the one that works for you in whatever combination and dose works for you. I do not have a cutoff saying I don't prescribe more than 30 or 60 milligrams of Armour. I don't prescribe anything else than Armour or NP. Oh no, we can't touch that liothyronine. That's going to cause bone loss and a heart attack. I won't go over 5 or 10 micrograms of liothyronine because that's top limit. That's all I will prescribe. What if you need more? What if you, like me, need a higher dose of whatever, Armour, NP, Lio, whatever? What if we need to mix it up? What if we need to give you a little bit of Armour and a little bit of T3? You know, change that ratio that I'm always talking about. Your reverse T3 is a little bit high, but it's not that high. But you're tolerating the Armour. Oh, let's drop it a little bit and add in some T3. There's so many things we can do. And if you're a practitioner, will not think outside of their box. It doesn't have to be a Synthroid box. It doesn't have to be a conventional medicine box. If they're not thinking outside of their own box and they have parameters and limits on how far they will go with you, it's time to run and not walk. It is time to fire your doctor. It is time to chalk up that money that you paid them as a loss. Maybe find out how to take it as a write-off somehow. Listen, we have all wasted money. I am not coming from a place that I haven't. I am coming from a place of understanding, believe me. Thousands and thousands and thousands of dollars given to people or organizations that I trusted, just like you do with whatever, a program, a functional practitioner, an integrative practitioner, or a shit ton of copays to your conventional doctors because you're jumping from endocrinologist to PCP to endocrinologist because you really, really want your insurance to cover it. And now you've wasted hundreds, if not thousands already. And then you've wasted more on the Band-Aid medications that are doing damage to your body instead of just optimizing your body from the first place. I get it. I get it. I have wasted money. Sometimes you just have to chalk it up. I know it starts eating away at your brain. You have to chalk it up as a learning experience. Put it toward education. Take it as a write-off of education, right? I've had patients come to me who have dropped 10 grand with a practitioner to no avail, to be put on some detox protocol. And then they're not better. I know it's a lot of money. That's an extreme example, by the way, but you got to chalk that up to education, to never do that again, to be more cognizant of who you're going to work with, to ask questions. Are they a thyroid and hormone specialist? What kind of medications do they use? What kind of testing do they do? Do they do bioidentical hormone replacement? All of that is important when we're talking about optimization. It's vital. It's vital. It's vital. So those are some key points that I really want you to think about, because I know so many of you are sitting there going, oh, crap. She just described my situation. Now I have to go find another practitioner because I'm not going to get anywhere with this one. But hey, if you have that realization right now, guess what? You've just saved yourself time. And life is precious and it is short. And I know that's a cliche, but it's passing by whether you want it to or not. So what are you going to do with the rest of your life? I want you to be optimized. I want you to feel great. I want you to live your best life possible. I want you to be the badass human that you're meant to be. But you can't do that if you're wasting time jumping from doctor to doctor, crossing your fingers and wishing on a rainbow that this one is going to listen to you and test the right way and treat the right way. And then you're going to feel good. Sometimes you got to make a different move. Got to make a different move. So yes, you can always call me. We can absolutely work together. I do all of those things that I just told you to run from if a doctor does not do. But if you are in a different country, well, I can still work with you in a different country because we do. We just can't prescribe to a different country. That's the problem. But we can do workarounds. But if you are hell-bent on using your insurance, at least use this as a guideline. But please don't spend more than 6 months of your life, because that's 6 months that you could already be optimized. I get people optimized in 4 to 6 months. Come on, don't waste 6 months because you could already be well on your way right now. If you're hell-bent, then use these guidelines and set parameters, set your own boundaries to say that I will fire my doc or run, not walk away from anyone that violates any of these principles, any of my boundaries that I am setting up based on this podcast.